few minutes more and see whether people will join.
It's always best.
Yeah.
No, we're live. We can start.
I think Alice has spent a whole lot of time preparing to come and deliver for only 3 people.
It's okay, Robert. But it's always best. What I do is because I always have these conferences at 12. So what I do is the first few minutes you can show a short video of something.
Yeah.
Maybe 5 minutes or 10 minutes as you wait for people to come in.
Yeah. Okay.
Yeah. But I mean, it's natural. People will drag themselves in, but at least you give them 5 minutes or so, and then you can get. But it's okay, Robert. We just do what we have to do.
Yeah, exactly. I mean, once they have YouTube channel, people can watch it later. So, and those joining online also. But it's great to see you again.
Nice to see you, Robert. You've been quiet. You don't like me anymore.
Oh, I think it's because the semester has started, and Hiba told me you were running this program, and I see how busy it can be running such a program. Yeah. So I think that is why we haven't been in touch.
Yeah, it's okay.
Yeah.
Yeah. You should be speaking soon. I'll give you a topic earlier. Last time I was not well planned, organized. This time I'm more organized.
Good.
Yeah.
Good. We'll probably need to also meet because of the school. Well, we'll discuss that later because this is CAHN program.
Yeah. Yeah. I'm ready when you are.
So do you suggest we start? Because it's 5 minutes past.
It's okay.
Yeah. Sorry, you did. I mentioned it before. I thought you guys. Yeah. We can start, please. The recording will be online, so people can come back and watch it.
Okay. All right. So welcome to today's session. Your regular host Hiba Osekwesi is not in today, and I'm going to sit in as a facilitator or a moderator today. And today we are going to be talking about a very important topic, a topic that is so very vital that we can't afford to miss it, or we can't afford not to discuss it. And we have one of our experts that we already know. Alice is not is a household name. She's going to be talking to us about sexual health. And I would say that please ask her as many questions as you can, because sexual health is so important. Poor sexual health can affect other parts of your health, or even your overall health, your physical health, mental health, emotional, or even social well-being. So it is important that we take very good care of our sexual health. But most of us probably do not know or are not well informed about our sexual health, or don't know how to maintain a good sexual health. And I think that Alice would, at the end of this session, would enlighten us, and we'll get some few tips to be able to maintain a good sexual health. So put your questions in the chat box, but then at the end of the session too, there's an opportunity for you to unmute yourself and talk. But at the moment, just mute yourself when you are not talking, and then we listen to Alice. We take notes, and then we ask the relevant questions, so that we'll get ourselves well informed. So Alice, if you are ready.
Yes, I am ready. Do I have the share? Okay, I can share.
Yes.
Well, I'm going to use presentation. So you can hear me well?
Yes, I can hear you well.
Okay, good. If you can hear me well, that's okay. Last time, I think somebody said I couldn't be heard well. So Caribbean, if you are fine with my volume, then we can carry on.
Yeah, Dr. Alice, we're fine. You can go ahead.
Okay, fine. So we're talking about nutrition and sexual health for men and women. And so it's really a wide topic, but most people think there's just an instant solution like this to sexual health. But let's see what we have in store for you. So, are you sexually healthy? WHO defines sexual health as a fundamental to the overall health and well-being of individuals, couples, and families, and to the social and economic development of communities and countries. Like, it is so fundamental. It affects families and communities as well. It is, when viewed affirmatively, requires positive and respectful approach to sexuality and sexual relationship, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence. So this is the definition of sexual health according to WHO. Also, sexual health is the ability of men and women to achieve sexual health and well-being, which of course depends on, information, communication, their general health, and of course also getting an opportunity to see a sex education expert. Oh yeah, I've defined sexual health. So let's start by looking at sexual diagnosis in men. Men tend to have a lot more sexual issues, or not quite. Maybe they are more diagnosed. There've been more research and there's been more diagnosis in their sexual health. And remember, just like any other condition, diabetes or high blood pressure, we have to diagnose what the problem is, because just treating blindly doesn't help. It could just be a simple thing as psychological problem. That's why there's unhealthy, where you're sexually unhealthy or sexually healthy. So men have a few conditions. So some of the conditions that can affect men include mental health, depression, anxiety, and stress can play a role in unhealthy makes you sexually unhealthy. And also physical health. Issues that may lead to sexual dysfunction can include hormone imbalances and diabetes. Lifestyle choices such as smoking, drinking, and using drugs can also cause sexual dysfunction. So it's just the normal things about life and being healthy. You have got to stay away from some of these things. Also, age is a factor. Studies have shown that 52% of males aged between 40 and 70 experience sexual dysfunction to varying degrees. And according to a 2019 study, aging impacts sexual function. This may be due to the development or progression of certain health conditions, such as cardiovascular issues, or maybe your blood vessels are inflamed and there is cholesterol. All these things can affect your sexual health. But it is possible to take care of yourself so that it does not affect you. I mean, 40 is really young. And so if you're having if you're sexually unhealthy at 40, then it means we have a bigger problem. Because one thing for sure is that the blood vessels in the penis are smaller than the heart. And so when men start to have an erectile dysfunction, that's always an indication that it's a heart attack waiting to happen. And so it's just same thing, watching your diet and exercising and lifestyle, which we shall discuss. Sexual dysfunction may have problems with sexual, can include you don't have sexual desire, there is poor arousal, the person may not feel aroused, there is no orgasm, or they may not be able to experience orgasm or get a climax. And so we have various conditions that actually have been diagnosed. So we have erectile dysfunction, which is a recurring problem. And what it is, it affects achieving or maintaining an erection that is hard enough for sex. So the erection is not hard enough for sex. That's erectile dysfunction. And the causes, first of all, it can be a symptom of an underlying problem. According to the National Institute of Health, which is an American organization, males with uncontrolled type 2 diabetes are 2 to 3 times more likely to develop erectile dysfunction than males without diabetes. So you can have diabetes, but if it is not controlled, then you're likely to have erectile dysfunction. So it means that if you have erectile dysfunction and your diabetes, then we need to control your diabetes. That would be the first. Intervention. So how do we treat erectile dysfunction? Lifestyle changes, exercise, healthy eating, and quitting smoking. You know all this, but I'm going to talk about nutrition at the end. Sometimes they have to be given medications such as Viagra, and this should really be prescribed by a doctor. And also they can be added testosterone levels. If their testosterone levels are low, they can get an injection. They can also be given penile injections or suppository. They're actually drugs like this where they inject medicine directly into the penis that can help a person achieve an erection. So, or they can get a suppository that is inserted in the urethra. And these medications are actually there, they're available. We also have penis pumps. These are tube-like devices that can help create and sustain an erection by pulling blood into the penis. And I've seen this around here being done. Sometimes they need surgery as a last resort. Then we have low libido, which is usually a problem between men and women. It's not just for men. Libido or a low sexual drive is persistent lack of interest in sex or lack of sexual desire. It is not uncommon, but it is something that happens. It's also affected by hormones, by age, and by your mental health and other circumstances. For example, if you're always fighting with your spouse, then the libido is just going to be low. It doesn't mean there's anything wrong with you. What it means is you need to sort out your emotional health so that your libido can go back to normal. And of course, sometimes it's age and sometimes it's really hormones. So you will need to do some of these medical tests. When low libido feels distressing or impacts a relationship, then you have to get help. And we've already said what the causes are. Some of them are underactive thyroid. So people with hypothyroidism, low testosterone levels, depression, stress, or certain medications. So how do we treat low libido? Study found that testosterone therapy improved libido in men whose testosterone levels were low. So they can actually go and get testosterone therapy. But this means you have to actually go to the hospital and do a hormonal test, and the doctor needs to be sure that this is low, and then you're given. Sometimes you're given medication. If libido is a side effect of a treatment, then it may also be removed. A lot of diabetes medication and even blood pressure medication, these long-term medications, whenever you're on these medications, if you're diabetic or hypertensive, you need to check the side effects. Some of them actually lower libido. And then what is the thing is you have to diagnose the problem and then treat it. So they have to diagnose it. If it's a side effect of medication, then the medication will be removed. Also, treating low libido includes treating underlying conditions like underactive thyroid, like we said, also diabetes. Exercise shows that a study showed that exercise can help men with low testosterone to cope with low libido, relationship changes, and body image concerns. So exercise increases your libido because you get hormones, endorphin levels increased, gives you a feel-good factor, and this automatically increases your libido. So if you have low libido and you're not exercising, then you need to start exercising. Then, of course, therapy like counseling, depending on if it's an emotional problem. We have another problem. It's called premature ejaculation. This occurs when a male ejaculates earlier than they would like during sex. People may also refer to premature ejaculations as premature climax, early ejaculations, or rapid ejaculation. So you're not done, but then it just comes out without your knowledge. So this one is associated with low serotonin levels in the brain, which can reduce the time it takes to ejaculate. So serotonin levels have been associated with your food and your diet. So if you don't eat well, you stay long hours without food, it affects your serotonin levels. And so this is actually when you're malnourished. So when you don't eat healthy, then it can impact your it impacts your ejaculation time. And of course, depression and emotional issues, stress, can be stress at work, stress in your life, anxiety about sexual performance. You want to please your spouse, but you're not able to. So what needs to be done here? You just need to identify what the problem is and then manage it, because we know that sexual health is important, and it impacts individuals, impacts communities as well. Sometimes also things like lack of confidence, relationship issues, and aging can affect, can cause somebody to have premature ejaculation. But whatever it is, these are some things that are actually a lot easier to resolve than big conditions like cancer and diabetes. So how do we treat this? Psychological therapy or counseling, behavioral therapy to train the body to delay ejaculation, medications to affect serotonin levels, or dietary education to increase your serotonin levels, applying topical numbing creams or sprays to the penis to decrease sensation before having sexual intercourse. So these are available in our markets. Some of those conditions we've talked about, most of them affect women. The only one that affects both men and women in that list is actually low libido. But women with low sex drive, it means that they usually have causes of low sex drive is they have the thinning of their genital tissues, or vaginal dryness, or pain triggering spots. So these are common. So if you have a low sex drive, then you need to do a pelvic exams to examine if you have genital tissue is thinning, vaginal dryness, or pain triggering spots. Also, you need to test your hormonal levels to see what is your hormone levels. Are you having low hormone levels? And do you have thyroid problems? Are you diabetic? Do you have high cholesterol? Or do you have any liver disorders? Because some of these conditions can affect your libido. Then you have to evaluate your emotional state by seeing a specialized sex therapist or a counselor. Yep. So those are diagnoses for sexual health. So you have to diagnose the problem. You have to diagnose the problem. Remember, even if you're going to take vitamin, whatever it is that you're going to take, if you do not diagnose the problem, you should not treat it. Maybe you have a low libido and it is being affected because of testosterone levels. So you take supplements, you do different things, and you get no results. It's because you have not diagnosed the problem. So that is my recommendation. Make sure that there is a diagnosis. So you all know the basics of nutrition. What are some of the basics of nutrition? Let me just ask people here. I don't have them on my slides. But what is the basics of nutrition? Can I choose Robert? Basics. What are basics for nutrition?
Is it me or the audience?
Yeah, I choose you. It's everybody.
Well, I mean, just having a good balanced diet.
Mm-hmm. The basics, yeah.
Yeah.
Mm-hmm.
Having a good balanced diet could be is the main key one.
Thank you. Anybody else? That's a good one. Yes, so true, very true. Anybody else wants to try? Andrew, may I choose you, please? What's the basics of good nutrition?
Someone has dropped a message in the chat box saying that balanced diet, fruits, vegetables, pulses. Okay,
very good. Thank you, Martha. Yes. So the basics of nutrition is, you need a balanced diet. You need to eat more food in the morning. You need to eat less food in the evening. Why do we eat? Bodybuilding, energy, protective, repair and maintenance. So you need to eat starches. You need to eat vegetables. You need to eat proteins. You need to eat fruits, and you need to eat fish and nuts and drink lots of water, like somebody has added there. So those are the basics. So remember, anytime you have to be diagnosed with a problem, if your diet is bad, it actually takes the medic to diagnose the problem, because they're wondering, what is it? Because if you don't eat healthy, you're going to be tired, you're going to be fatigued, and you're not well. And so it's always important to eat healthy. So they rule out lifestyle as a problem. Always rule out lifestyle. So the basics, so when it comes to nutrition, the basics apply across. Healthy or unhealthy, you must just eat healthy, and those are the basics. Lifestyle issues that are associated with sexual health. Obesity has a negative influence on male fertility, and weight loss improves male fertility. And this is directly related to libido, ejaculation, and erectile function. So if you're overweight and fit, you don't have a problem. If you're overweight and unfit and does not exercise, does not have a physical activity, then it increases, it worsens all the problems, all the sexual problems you've identified. If you don't sleep well, you're always tired and fatigued. Remember, the body repairs itself. So even you're weak, your muscles are weak, and you're more likely to suffer from erectile dysfunction, you're more likely to suffer from low libido, and of course, having a low sex desire. Dehydration is a major cause for low libido, because dehydration, you need circulation. But studies have shown that dehydration, so not taking enough water, impacts your sexual energy, impacts your sexual health. And of course, also lack of exercise. Exercise always improves blood circulation. So you need exercise to improve circulation. You need, circulation needs to happen in your penis, you know, there has to be improved circulation. So what happens is you have to exercise and then eat the right portions at the right time. So I tell my clients this, you see, if you're at work the whole day, then you come home, then you eat a large meal. You see, that large meal needs digestion. So a lot of the blood supply goes to the stomach for digestion. And when you want to have intercourse, there is a struggle of the sulfur supply, blood supply between your stomach and between the penis. And that makes it makes your sex hard, or your intercourse, it makes it difficult. You're tired, you're stressing, and so you're likely to have premature ejaculation, or you're likely to have a temporary erectile dysfunction. So you should never be on a full stomach when you want to engage in intercourse. So research on diet and sexual health. What is that the research show? The research shows that certain groups of foods, like if you eat a lot of foods which have got a lot of sugar, high glycemic index foods, foods which are refined and processed, you eat a high carbohydrate diet, you eat a lot of meat in your diet, this actually affects your sexual health negatively. And of course, also fertility for both men and women. But if you eat the opposite, increase omega-3 and omega-6 fatty acids, that comes from your fish and avocados and nuts and seeds, natural healthy foods, a low carbohydrate diet, you know, moderate vegetables and proteins and antioxidants. This improves your sexual health. So studies have shown that isoflavones have a negative impact on men fertility and improve sexual health on menopausal women. But this is to do with fertility. However, isoflavones are from beans. Beans have been shown to actually even increase the semen concentration, contribute to increase of testosterone. So those are some of the foods that we are just going to talk about briefly. So I'll repeat this. If you eat refined foods, processed foods, and in plenty, then it impacts your sexual health negatively. If you eat your natural foods, natural whole foods, you are more likely to improve your sexual health. Foods that increase libido: nuts and seeds, nutmeg, raw garlic, especially for women, and onions. So these ones are, maybe some people call them aphrodisiacs. So you can include this in your diet. You'll find that some men will take nutmeg and it really works for them, and women, but some of them, it might not work for them as much. So it doesn't work for everybody, but these are the common ones that they say if you include in your diet, it actually improves your sexual health. So it's important to include this in your diet. But remember, you have to diagnose the problem, treat the problem, and then improve your diet, and then improve some of these foods that you can use that can improve your sexual health. And then foods that have been shown in some studies that increase testosterone levels include oysters. This is a type of fish, natural organic eggs, fresh ginger, a lot of beans in your diet, as well as onions. So these are natural foods that increase testosterone levels, but remember also your exercise also helps. So dietary supplements, there's really weak evidence, but some studies have shown that there is a supplement called yohimbine, which is found, it comes from India. So I don't know if you find it there. And then vitamin Bs, this is usually B or B complex. This is definitely to improve some, what are they called? Nerve cells and nerve fillings. And then arginine is an amino acid, and vitamin D, which of course, if you live in some parts of the world, you just need to always be out in the sun at the right time. So remember, genes load the gun, but your lifestyle pulls the trigger. So your lifestyle always pulls the trigger. So just do the right thing. You've been given a body, take care of it, and take care of your lifestyle, and you will be fine. So that is all from me today for your sexual health. I will take questions now. Thank you very much. You're muted, Robert.
Yeah, so thank you very much, Alice. That was very, very informative. I'm just wondering why people are not, people did not log in. I was expecting over maybe 60 people log in because this is a very important topic, and it's apart from the fact that it affects other parts of, other aspects of health. It breaks families and it has so economic links to so many social issues. And I was expecting that people would be asking a lot of questions too, but I'm sure that people would want to talk directly and ask questions to you. So I'll open the floor now for if you want to talk, you just raise your hand, you'll be called, and then you ask your question.
Or post the question on the chat if you wish.
Yes.
Yeah.
So before maybe whilst we wait for others to ask their questions, I have a couple of questions that I want to ask.
Yes.
I think most of the discussion has been very useful for men, and I'm a man. And I want to ask, even though there are women here also, probably they can convey the message to, family members who needs this information. You've talked about the risk factors. You've talked about the risk factors being diabetes. If you have diabetes, you need to really be watchful of your sexual health. You've talked about mental health. Stress, anxiety, and depression are all precursors of affecting your sexual health. And then the libido aspect is what I want to find out. So you talk about libido in women and both women and men. I wanted to find out, do women experience sexual dysfunction?
Yeah.
And how do they know that they have?
Okay, for them, it's low sex drive. They have a low sex drive.
Okay.
Yeah, so they're not available for sex. They don't want to, which can be also classified as low libido. But this one is, they have to do, depending on what their age is. Sometimes it's also just psychological, relationship issues and stress, perhaps stress. Like if a woman has just given birth and the child is crying overnight and things like that, the sex drive just goes down. It doesn't mean they have a problem. It doesn't mean they have another underlying problem. But as we get older, 45 and 50s, then the urge goes down, then you need to check. Sometimes it's because of your hormones, like you said, or you have your the thinning of your genital tissues. there's a lot of vaginal dryness, and then you have pain triggering spots. So if you're having intercourse, then you feel pain, and so you don't want to have it. Yes.
Okay, that's good to know. Igbo or Iyabo, sorry, if I pronounce your name wrong. Iyabo, I mean, you've raised your hand. Do you have a question?
Yes, thank you very much. Thank you for the lecture. It was quite informative. Thank you. You said something about beans, you know, and when we had discussions sometimes about the type of food that could be good for one, beans was mentioned, but there was something that was mentioned about fermenting beans. Can you shed light on that? That when you want to cook it, first of all, ferment it before you cook it. I wanted to find out, will you use the same water for the fermentation to cook it?
You know, fermentation is a special science, and I should leave it to people who talk about it. But the basics I know, whenever you ferment food, you have what are they called? I've forgotten. But you have some nutrients that are readily available that are very friendly for your gut. So obviously, yes. So but the nutrient is in the beans. It's not in the water. It's in the beans, you know. But if the water is also useful, then we need to talk to the expert in fermentation.
Okay. 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 Because I wanted to, all I just wanted to know is whether after fermenting it, there will still be water in it. Will you use the same water to cook it, or you get rid of the water and put fresh water? That was what I wanted to know. But thank you very much anyway.
But usually, I think I can also answer that. Usually, when you're soaking your beans overnight, you don't want and fermenting them, because some of the nutrients that are water soluble, I have leaked out onto that water. So you don't want to pour it. So always wash your beans first and then soak it with the water that you can use to cook it, because the water soluble nutrients are already in there. So you don't want to pour it out and lose them. Yeah.
Okay. Thank you.
You're welcome.
Yeah, no, so that is a practice that we observe growing up, isn't it? Where, you know, beans are soaked, and then after that you throw the water away and then use a different water to wash it. Yes, and I think that Alice has rightly, you know, talked about the water soluble vitamins. So if you soak your beans and you pour the water away, you probably will be losing the water soluble vitamins. You may not lose other vitamins, but the water soluble ones may be lost, even though you are going to cook it with water. And yeah, I mean, we can talk about these things. We can bring experts to come and talk about fermentation, if that's going to be a topic that people would like. Any other person?
I think you have a video that Robert, you have a video. There was a session on fermentation, and so there's a YouTube channel. There's a YouTube video, I think. So maybe they just need to go to the CAHN website.
Yes. These days there are a lot of people did very educative. But we have to be careful, because not everything you find on the internet that is giving us the right information. But yes, some very useful YouTube videos are there that we can easily learn about.
Yes, I know there was a program of fermentation which was done, and I've decided to try it, and it's working. But I just wanted to be sure, because when they say you soak your beans before you cook it, because when I eat beans, I like beans, but when I eat it, I have, you know, rumblings in my stomach, you know, at times farting. But when I tried that fermentation, I think it really worked. I wasn't having that problem. And I cook it with the water, but I just wanted to know whether I should continue to cook it with that same water or use a fresh water. But I think she has answered that question, because some vitamins, water-soluble vitamins, might be lost when I, you know, drain that water off. Thank you.
Yeah, the other thing I do to improve my bean intake is I sprout it. So I soak it with little water, and then when it sprouts a little bit, then is when I cook it. So it even takes a shorter time to cook, and it's like I'm eating fresh beans actually. Yeah.
But how long do you soak it?
1.5 days. But you don't soak it with a lot of, once you wash it, you drain out the water and leave very little.
Okay. Thank you.
And then you just, so once you start seeing the little bud coming out of the beans, then you cook it.
Yeah.
If you leave it for too long, then it also spoils it. So yeah.
Okay,
Thank
great. I don't know whether Mama Catherine, do you have a question to ask? Now you need to unmute yourself.
About soaking the beans for fermentation. I think, it is good. But what I wanted to ask, I think the other lady, Dr. who did say it, because of the spray things, they like to preserve the beans for insecticides. So if somebody can rinse it out before soaking, then that's okay. Are you with me?
Yeah.
Yes.
You just the initial, as you put the beans, you soak it up, wash it just for a few minutes and drain off, soak it again and wash it off. Wash the insecticides that they spray on it. Then before soaking it overnight, then you can cook it with the water.
Yeah.
Okay. So there's something we call, I don't know, Mama Catherine, whether you are a health professional, but there's something we call positive deviance. Our grandmothers and used to do things that are very that there's evidence now that they were doing the right thing, but we didn't know they were doing the right thing. They didn't know that what they are doing is the right, but we know that it was useful when you do this kind of stuff. So I just wanted to find out whether this is based on your technical knowledge on it, or is based on your the traditional knowledge of preserving beans or cooking beans.
Yeah, I'm a retired nurse, but the thing is that, like you say, our parents, I learned from my parents and other elderly ones then that because the beans are fresh from the farm, and you wash it and cook it, or even if you soak it overnight, you still cook it with the water that you soak it. But these days, because of the way they want to preserve it, especially for transportation coming from abroad to this side or any part of the world, they spray it with insecticides, which is not good for the health. So that is why I was saying, if you soak it, if for a few minutes, wash out so that you get rid of those unwanted insecticides, and then soak it overnight. Then you can cook it with the water.
Okay.
It seems I'm not making clear. Or
no, I think you are. You've made a good point. You've made a very good point. Because you buy things on the market, you don't really know how it was handled. So it'd be good to wash out, whatever, not just insecticide, but maybe any dirt that's maybe in contact with the beans. Then before you soak it. Yeah.
Okay. Thank you.
So Alice, you were going to say something before Mama Catherine came in.
No, I said it. It was about sprouting beans.
Okay. So I wanted to find out again, how do you know that you have poor sexual health without diagnosis? I mean, leave the aspects of sexual, the sexual aspect of it, like ejaculation and all those stuff. But if you have a poor sexual health, would you be able to tell by signs, apart from the erectile dysfunction and low libido, would you be able to tell that you have poor sexual health?
Yes, because because your sexual healthy means that you have the desire, and you want the desire to be fulfilled, and you feel fully fulfilled and satisfied. That is sexually healthy. When you're sexually unhealthy, there is no desire, or the desire is low. And even when you have intercourse, you're not feeling fulfilled. So it could be you, or it could also be your partner that is not contributing to your fulfillment. So it can be because of some of those problems we've said. So you can have the desire, you go on and you want to meet your spouse's sexual needs, and it's a man, and you have pre-ejaculation, or you don't sustain your erectile dysfunction. So there are obvious symptoms, just the desire alone. You don't want, you don't care. And usually you find that, yeah, when you're married, you know, you have it so often, every day, and then it goes down to 3 days a week. And then you'll find the time you're going for weeks without it. It means there's a problem, you know. So you need to talk about it. So it can be diagnosed easily. You don't have to go to the hospital to diagnose. What you need to go to the doctor to do is to find out what's the cause of this problem that I'm feeling.
Mm-hmm.
What is the cause of this problem? Then the doctor will do an investigation, find out maybe it's hormones, or it's your uncontrolled diabetes, or your blood pressure, or your cholesterol, you know, things like that. So.
Well, so I'm asking for those of us who are Reverend Sisters and Reverend Fathers, and we don't have we don't have partners, whether, for example, mood swings or having, you know, being depressed most of the time could be a sign of that you probably don't have, because how do you, if you don't have a partner, how do you know that you have a poor mental health?
Of course you can't. You only know if you're sexually active. If you're not sexually active, then you don't know.
Yeah.
So you have to be sexually active for you to know you have a problem.
Okay.
Yeah.
So the key word is that you need to be sexually active to be able to self-diagnose yourself whether you have a poor sexual health or not. Okay, good.
And usually when people listen to talks like this, then they can start stressing, oh, maybe I have a problem. No, maybe you don't, but just, you know, understand and appreciate. There's a question in the box and I'd like to answer it.
Yes.
I think some people find it hard to speak about their sexual health. It is seen as a private matter, in particular if people are married or in a long-time relationship. I think men in particular find it hard to admit to having sexual issues with their sexual health. Yes. And you see, it's a problem if you don't discuss it. I was reading about a study where they just put women together. All they needed to do is just talk about sex. They were not supposed to ask questions and they were not supposed to give advice, but they just discussed it openly. And just the fact that they discussed it, it actually improved their sexual health, just like that, you know. And usually it's communication in the relationship is really important. And sex, we need to talk about it because this is a fundamental, sex is fundamental for your well-being when you're in a relationship. So it is very important to talk about it. People shy away from it, especially Africans, but it doesn't help you to shy away from it. It doesn't help you. You need to say, okay, I don't think we're having it often. What's wrong? Can you see a doctor? Can you see a sex therapist? You know, and talk to them. There are so many sex therapists, and I think they're the busiest people. So if you're not talking, you're alone. You need to talk so that you can get help and you can get support.
Yeah, that's a very useful one. And I think linking up to that, you know, I think I was going to ask you about psychosocial therapy, because you have a partner in a man and a woman. The man has this maybe erectile dysfunction or early ejaculation or whatever you call it. And the woman can play a part in addressing that, because if she says, well, be a man, you don't behave like a man because you can't do anything, you know. Something like that, even if you are getting medical intervention and you come home and you are not getting that support from your spouse, and they keep putting that negative stains on your this thing, you may not be able to recover. And I wanted to know about the role of psychosocial therapy.
Yes, psychosocial therapy is very, very important. In fact, the most important. And so it means that both of you have to get that therapy. Both of you have to get the support, because you have to completely resolve what the problem is, because it affects you. And for men, unfortunately, it affects you so much that you are not able to even get an erection because of the stress and the emotional stress that you're going through. So you have to talk about it as a family, and you have to get help. And you need to talk about it early in the relationship, because if there's something that your spouse does that just puts you off, then you need to deal with it immediately. Yeah.
Okay.
I mean, I was talking to, well, I've worked with people. Okay, specializing in obesity also. I have to specialize in sexual health, because there are a lot of people who are overweight and they have challenges with sex, and this is really just physical challenges. How can they have sex? How can they have, okay, I'll just say sex or intercourse, whatever it is. There's no offense to anybody, because of positions. You have a big stomach, the other person has a big stomach. You know, how do you have a satisfying sexual intercourse? And so I had to learn a little bit, and then positions and things like that. But I remember one of my clients a long time ago just saying that, you know, every time that the husband just touched her belly button, or umbilical cord as you call it, just that he touched it, that was enough to completely put her off, and she was not able to get get a drive. And he told him time and time again, please don't do that. And he did that intentionally, and it completely affected their sexual life.
Adiola, are you asking a question or you are contributing?
I think he was just talking. So you need to get help, and you need to get help early.
Okay.
Yeah.
Yeah.
No,
I have friends who have similar experience, where the lady doesn't like certain touches, and then, and if the man keeps on doing that, that can really put her off, and that can affect their sexual health. So I think it's important to explore the person also, and know what they want and what they don't want.
Yeah.
There's a question in the chat box. The person is asking about old age, because you mentioned old age, that old age could be a factor for maybe things like erectile dysfunction and all that. And they want to find out, what are the foods that you need to eat at old age to improve your sexual health?
Yeah, thank you. First of all, at that age, mostly what also really supports you is exercise, very important. But we have foods that actually increase your libido, and this we say are nuts and seeds. Include this in your diet. Nutmeg is a spice that you can just put it in your tea and then you drink it. Raw garlic, especially for women, where you just put raw garlic before you go to bed and make a juice out of it, or just take it like this. It's been shown to work. And also onions, onions and garlic from the same family. So you need actually to take fresh garlic. So grate it and just take a spoon, But remember, other things are also important. Sometimes you can also, depending, is it dryness? If it's dryness, then you're always given a cream to help with that. And so you can use a cream. And also exercising, or just walking regularly, making sure you take all your water, also improves vaginal lubrication. Yeah.
Okay. Okay, so there's another question. So can erectile dysfunction be a sign of any other health issues?
Yes. I think I said that. I'll just repeat again. Yes, erectile dysfunction can be a sign of uncontrolled blood pressure, like you said before. I mean, uncontrolled blood pressure, uncontrolled diabetes. And also, it can also be because of emotional issues that you can have erectile dysfunction. So it can also be some other unidentified underlying problem. Yes.
Okay.
And also remember, also some medications can cause erectile dysfunction. So if you're on long-term medication, then you want to also discuss it with the doctor so that you can understand, you know, yeah.
Okay.
You can be treated, yeah.
What would you say? Because there are some people who really use alcohol as a aphrodisiac. I mean, they drink alcohol and they really get sexually aroused. What would you say about that?
Well, that's not, yeah, it's been shown that it can arouse, but without alcohol, can you also be aroused naturally by doing something? Mm-hmm. So if it is just that occasional that you take it and you get aroused, that's okay. But it should not be a habit, because when you drink, long-term drinking actually affects erectile function, long-term excess drinking. So if it's just that occasional once in a while, yeah, why not?
Okay. Good. Any further questions? I know a lot of you have questions. Just drop them here, because I mean, it's a very important topic that there's, you know, someone said that every man in their lifetime would have poor sexual health. I mean, would have issues with erectile issues and all that. So it means that we have all experienced it in one way or the other. Do we want to ask questions about how we can improve that?
People like Andrew said earlier, people don't want to talk about people. It's not something that people talk about. So talk about it. You're behind the camera, we can't see you. Just write it or send me a private message, and then I will just read it out loud without your name.
Yeah.
You know, I remember when I was early in my career as a nutritionist, HIV was so rampant. It was a big problem in this country, and I'm sure many other countries around the world. And I remember going for a conference, and it was about how do we prevent HIV? What do we do to prevent HIV? And so the church people had something to say, the traditional cultural people had something to say, the psychologists, the nutritionists, everybody spoke. But there's this one lady who came, she was a psychologist. She stood there and just made one statement. She says, HIV affects sexual health. It is caused by sexual health, and it's affected by that. So if we are not going to talk about sexual health, sex, challenges, and joys, then we are never going to prevent HIV. So it has to start from being able to freely talk about sexual health. And so I remember after that, the conference was over, because people are like, yeah, so you have all these solutions, but it's not something that people talk about. How is it going to help? Mm-hmm. So also today, if we don't talk about our sexual health, you can be found with a problem, you know?
Yeah, and sometimes it starts early. Sometimes you have the early signs and you don't talk about it, you know, and people will begin to use alcohol to, you know, to think that they are really addressing it. But we need to be informed to be able to talk about it well. So if you don't ask the questions, you wouldn't know. But there's a question in the chat box. But before I come to that question, I wanted to ask this question. Well, let me go to the chat. Ask that question before I come to my. Where's the?
I can see it. Do you want me to read it?
Yes, yes, please. Yes.
Can not having sex affect your health?
Yes.
Yeah, I think if you're married, it is high in the hierarchy needs. It is high. It's on top. It's like food. So you need it. So yes, it will affect your health emotionally. If you're married. If you're not married, it's not part of your needs because you're not married and you're alone and you're single. So it doesn't affect your health. So it affects you emotionally. So it's important in a relationship, marriage relationship, to meet each other's sexual needs. remember also the Bible says, give dues, give your dues. The man should give their dues to the woman and the woman should give. So it is something that was created with God for a happy relationship. So it is important to have sex, otherwise it does affect you emotionally and more. And for men also who are, this is for all of them, but for men, when you're married and you don't have sex, you know, or not having sex, it can increase your risk of getting prostate cancer, because that ejaculation is extremely important. So you get prostate cancer, your risk is high of getting prostate cancer. So you need to have sex. It's important for your health, emotional health. Studies have shown that men who have intercourse, or men and women whose sexual needs are met, they're emotionally stable, they work hard, they really are they're more stable emotionally as compared to women who are married and their sexual needs are not being met.
Yeah, no, this is a very important information that we men need to hear. We need to hear that we need to increase the tempo. So thanks for telling us this. It would have been good for our partners to be part of this, to hear this, so that we don't say we are disturbing them. Okay. The question I wanted to ask is that when I started working, when I finished my undergrad and I was working with an NGO, so we used to have a driver who told me that, you know, he can't really do anything with his wife in the house, but when he goes out, he's able to. So he initially thought that he had problems with his sexual health, but when he goes out to try outside, he hasn't got that problem. So what can you say about that?
There is a communication problem in the relationship, or, you know, sometimes the way people are brought up, you know, somebody is brought up from this family. For the woman, maybe she was raped when she was young, that issue was never resolved. And so you'll find that when the man, you know, wants to meet her, to meet her needs, then she's scared, she is stiff. And so the man always just withdraws, you know, and vice versa. So then when they're out there, they can easily do it, but that's not right. Yeah. So they need to solve their problem, because each of them need to meet each other's needs. Yeah.
Okay, good. Because I didn't want to tell him, continue doing what you are doing, because I thought it wasn't right for him to do that. So it's good that I didn't tell him the wrong thing. All right, so I think we've gotten to the 7 o'clock hour mark, and I would want to say thank you very much, Alice. You have always been, you know, available when we call on you to come and share your expertise with us, and today is not an exception. So we are really grateful for this information that you are sharing with us. We would share that widely. Because information kept by, you know, when you have the knowledge and you keep it, you need to share that for people to learn and be able to pass on and help others. So thanks again for making the time. I know that you are 2 hours, was it 1 hour ahead of us, but you still managed to spare time to be with us today. So on behalf of CAHN, I would say, thank you very much for doing this, and we would always come back to you when we need your expertise. So, is Orlando, are you ready to take us through? Because Alice was saying that physical activity is important to improving sexual health. So, are you ready to complete us after receiving all this information? Are you ready to take us through the physical activity, Jenny?
Yeah.
Oh yeah, of course.
Good.
All ready. Let's do this.
Great. So take over.
All right.
Yeah.
So I hope everyone stays on the line, and I hope everyone enjoyed that amazing talk about nutrition with sexual health, a really very important and pressing topic. All right. So can you just spotlight me somebody as well? You get a chance to spotlight
spotlight
me. So welcome to today's boxercise session number 3. All right, we've got quite an advanced session for you tonight, so make sure you're listening and following. We've got some advanced moves coming your way. So yeah, make sure you stay locked in with those people. All right, so like normal, for today, all you're gonna need is a space, plenty of water, because we've got some good combos coming your way, and a mat as well. All right, just space, water, and a mat, and yourself and your hard work. That's all we need for today. All right, people. So let's start off. Let's get straight into it. Put this tune back. So we're going to start off with a 30-second shadow skip in 3, 2, 1. Let's go. Let's shadow skip. Let's go. Keep it nice and light, people. Ten seconds, my people. 3, 2, 1. Okay, just jabs only. Let's throw them jabs out. Okay, now throw that cross. Your right hand or your left hand dominant. Throw that cross, that power punch. Three, 2, 1. Next, we've got duck and weave. So if you've been on this box size session before, duck and weave, both defensive moves. For the duck, we go down and around towards our dominant hand. And for the weave, we go down and around toward the weak hand. Let's go, people. Keep working, people. 10 seconds. Three, 2, 1. And there's your first quick break, people. 20 seconds. Get those deep breaths in. All right, people, last few sips of water. Back to your spaces when you're ready. Let's get back into our warm-up. Get ready, people. So we're going to go another shadow skip in 3, 2, 1. Let's go. Get that skipping rope out. Okay, now if you can, let's go into one leg. Start with either leg. And change legs for me. Back to 2. 3, 2, 1. Next one, we've got skis. Stretch those legs, start stretching the groin out. Ten seconds, people. 3, 2, 1. Last one. Go. Jab, cross, pull. Last 30 seconds. Let's go. Keep that going, people. 5 seconds. 2, 1, and time, people. Rest period. 30 seconds, and then we're going to go into round number 1. "15 seconds, people. And then we're getting straight in that ring. Okay, people. Back to your spaces now. Let's get busy now. Round number 1 coming your way. All right, so round number 1, we've got a combination round. Okay, brand new combo for you guys. It's going to be a 3-minute round. I'm going to split it right in the middle. All right, so we've got 90 seconds of work with a specific combo, and then we're going to add to that combo. All right, so listen in. In your guard, again, right-handed here, you've got your left hand forward, power hand just below the eye, and if you're left-handed, you're obviously going the opposite way. All right, so let's start off with a jab to the face, boom, jab to the body, bang, left hook to the ribs. All right, same arm, 3 punches. All right, so watch again. Jab to the face, jab right to the stomach, and then twist, boom, right into the ribs. Okay, so watch again. Jab, jab, ribs. From there, we've got cross. Okay, so after that last hook to the ribs, come up and throw that knockout cross. So we're here, 1, 2, 3, knockout, 4. All right, work that. That's your first 90 seconds. And then we're going to add to it to finish the round. All right, people, let's get ready now. In your stances. Get ready. 3, 2, 1. Let's start the round. Let's go. 4 punches. Knockout. That's it, people. Work those 4 punches. Keep working, people. That lead hand's going to be nice and tired, whether it be your left or your right. Last 30 seconds, my people, and we're going to add to it. Keep working, people. 15 seconds. Three, 2, 1. Let's pause the clock. Okay, let's add to it now, people. So after that knockout cross, we're going to go hook, cross, to finish. So watch the whole move. Face, body, ribs, face, cheek, face, cheek, face. There, okay? Watch one more time. 1, 2, 3, 4, 5, 6, 7, 8. 8 punches, people. Let's go. Let's finish the round. 3, 2, 1. 90 seconds. Go. working, people. Last minute, coming up now, come on. Nice and sharp, people. Stay nice and sharp. 8-punch combo. Last 30 seconds. Come on. Keep working, people. Rest period coming up. Seconds. Four, 3, 2, 1. And there's the bell, people. 30-second water break. Definitely earned that. What a tough round to start off with. Make sure you're getting those deep breaths in. Get as much oxygen into the body as possible. If you have windows where you are, make sure the windows are nice and open. Let that fresh air in. All right, people, back to your spaces now. Back in the ring, let's go. So next round, we've got another combination round mixed in with defensive work. All right. So for your first 90 seconds, again, we're going to split it right in the middle. First 90 seconds, we're here in our guard. So we've got jab, cross. Remember your footwork, remember your body work, okay? Remember your strength and your power is coming from the floor. Okay, it's not all about the arms and the back. It's about coming up from the floor and really putting power into your punches. Okay, so we're here. 1, 2, 3, 4. From there, we've got a duck, like we did in the warm-up. Weave, hook. Told you we're getting kind of advanced today. So watch again. Jab, cross, hook, cross, down into your weave. Keep that guard up. Sorry, down into your, wait a minute. Down into your duck, then into your weave, then your left hook. All right, one more time. Jab, cross, hook, cross, duck, weave, boom, knockout, left hook. All right, that's your first half. That's your first 90 seconds, people. Get ready. Let me take this tune back. So combination mixed in with defensive techniques. Get ready. Okay, you got people. Let's go in 3, 2, 4. Let's get busy. Knockout. Ha! Keep working, people. 1 minute left. Hush. Hush. 30 seconds. Seconds. Last 10. Two, 1. Let's pause the clock. All right, right, let's add some more punches to that now, people. So listen in. So here again in our guard. Jab, cross, hook, cross, duck, weave, and after that hook, we've got cross, hook, overhand right. All right, so we're coming down, boom, right into the forehead. Watch again. Jab, cross, hook, cross, duck, weave, there. Bam, bam, boom. Finish the round. All right, let's go, people. Last 90 seconds. 3, 2, 1. Let's go. Don't get it. Watch me. I'll do it nice and slow. Bang. Overhand right. Wow. 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 Aish. Knock out. Let's go. Last minute. Knock out. 30 seconds. Work it, work it. Overhand, good. Keep it going, come on. 10 seconds. 5, 4, 3, 2, 1. And rest, my people. Back to your corners. 2 rounds down. Quite complicated one, that one. Ten seconds, people. Okay, people, listening now. Another special round coming your way. All right, so we've got pyramid round mixed with the legs. All right, and again, the 3-minute round is going to be split in the middle, so 90 seconds of work per moves. Okay, so first round, first 90 seconds, we're going to go in twos, like we usually do when we do pyramid rounds. All right, so I need 2 straights, and then we've got 2 lateral jumps. Okay, watch again. So 1, 2, 1, 2. Then we're going to go 4. 2, 3, 4, and then we're going to go 6. All right, 6 and 6, and then we're going to start right back at 2. All right, so watch again in your guards, all in twos. 1, 2, 1, 2. Make sure you stay nice and low on that lateral jump. Then we're going to go 4. Stay nice and low, really burn those legs out, and then we go 6 jumps. Start back at 2. All right. If the jump is getting a little bit too hard for you, then we can go slide. Okay, so either jump here, 2, or slide there. That's your first 90 seconds, people. Okay, let's get straight into it. So everything in twos, 2 straights, 2 lateral slides, 4, 4, 6, 6, then start back at 2. Let's get ready. 3, 2, 1. Let's start a round off. Let's go. Let's start back at 2. 4. 6. Just keep it going, people. 20 seconds, my people. Keep going. Seconds. Three, two, one, and relax. Okay, so last 90 seconds. We're going to change the punches and change the exercise. So now we're going to stay going in twos, but we're going to go uppercuts now. All right, we're going to go 1, 2. And then I either need 2 jump squats or just 2 normal squats, okay? So if you want to really push yourself, get those jump squats in. Not normal squats are fine, all right? So 2, 4, 6, start back at 2. Let's finish the round. Let's go 3, 2, 1. Finish it up now. Let's go. Eight, 4, 5, 6. Keep it going, people. Last 60 seconds. Two, 3, 4, 6. Seconds, people. Keep working now for me. Come on. Five, 4, 3, 2, 1. Now rest, my people. Back to your corners, quick water break. So last round now, people, bring your mats in. All right, people, last round coming up now. Let's work on those abs to finish. Work on those abs to finish. All right, people, so this 3-minute round is going to be broken up into 30-second segments, okay? So 6 30-second segments. Combo will stay the same. Exercise and move will stay the same. All right, so your combo is going to be jab, cross, duck, knockout, cross. Once again in your guard. Jab, cross, duck, knockout, cross. We're going to go there for 30 seconds. From there, we hit the mat, 30 seconds, and I need 10 bicycles, turn over, 2 push-ups. Back, changing levels every time. 10 bicycles, 2 push-ups for 30 seconds. Okay, go at your own pace, people. It's quite a tough round, this one. After that 30 seconds, we're back to our feet with the exact same combo. All right, jab, cross, duck, cross, 30 seconds, and then we're down 10 bicycles, 2 push-ups. 10 bicycles, 2 push-ups, and wait for my word. All right, people, last round now. Last round, people. Ab round. Let's get ready. Let's start with that combo. In 3, 2, 1. Start with your combo. Let's go. Go. Jab, cross, go, cross. seconds. Last 10. Three, 2, 1. Let's hit the floor for 30 seconds. Eight, 9, 10. Keep going, people. 5, 4, 3, 2, 1. Back to your feet now. Straight back into that combo. Let's go. Straight back in. Keep going, people. Yay! 10 seconds. 3, 2, 1. Change levels. Keep going. 3, 2, 1. Last minute, people. Back to your feet. Straight back to your combo. Keep working that combo, people. 15 seconds. Three, 2, 1. Change levels. Back to the floor. Last one. Ten seconds. 3, 2, 1. And time, people. Well done. That's a tough last round to finish with. Give yourself a 30-second water break, and then we'll cool down and stretch off. Well done. Yeah. All right, 10 seconds, people. All right, people, let's go straight to the middle now. So let's start top to bottom. Let's go neck, side to side, nice and slow. Ear to shoulder. Okay, arm rotations forward. Let's get all that blood back to the heart. Down backwards. Okay, hip rotations. 5 each direction. 2, 5. Change direction. That's 1. front to back. That's 1. Okay, either arm across the chest, pull just beside the elbow, put it nice, tight into your chest. Same arm behind the head, down. Same arm, fingers pointing towards the floor. If you've got a wall or anything, push it against the wall. So, try and get your palm on the wall. Change arms across the chest. Behind the head. One against the wall, fingers pointing down. Last one. Feet together, knees together, slight bend in the knees. Try and touch the toes, your toes on the floor. Hold where it feels uncomfortable. Come up nice and slow. Shake it all off. Last time, people, well done. Is Daniel around or Shakeen? I'm not sure who's on.
Yeah, good. Thank you, Orlando, for that session.
Thank you.
Can you hear me?
Well done, everybody. Tough ones tonight, that.
Thank you.
Yeah.
Good night.
Yes, Daniel, there you go.
Yes, okay.
Looking fresh.
Thank you. Yeah, thanks, Orlando, for that tough exercise section.
Yeah, it was tough, that one tonight, definitely.
Yeah, I hope if anyone wants to put in the chat box how they found the session. I saw Catherine taking part, so if you had let Orlando know how you found the session, and others online as well, just put on our socials how you found the session. Moving forward, we'll be having our Healthy Heart session again next Tuesday, same time, 6 to 7:30, 1 hour of engaging discussion, and then 30 minutes of exercise. Anything? What's next? Are we continuing exercise next week again, Orlando?
Yeah, so next week again, we're going to have some new combos, some more advanced. I want to try and go advanced now for the last 3 weeks. All right, try and really push the mind and the body a little bit further. All right, so yeah, we've got another 3 weeks of exercise. We've also got our radio segment tomorrow as well, if anybody is stuck for something to do at lunch. So we've got the CAHN Health and Wellbeing segment on Moods Radio, which is an online radio station. It's 12 to 1. And tomorrow's episode will feature he's a firefighter and aspiring politician named Elliot Bell. So it should be a really good episode. So if anyone's free, tune in, 12 to 1, Moods Radio.
Okay. Thank you, Orlando. And thank you, everyone. Thank you again, Dr. Robert and Dr. Alice, for hosting this session and sharing about nutrition and sexual health. And I hope everyone has a good night. See you all next week.
Well done, everybody. Have a great night. Thank you, Daniel.
All right.
Peace.